pastors at our church, and he's also running the tech world and
Well,
trying
hopefully
to do 10 million
we
things.
will not fail today, but I'm sure that it'll be okay.
Well, you probably do better than me. I'm a disgrace to most millennials when it comes to technology. As you can see, I was trying to get in for the last 10, 15 minutes, and I was just like, I was like, no, you could do this. You're 32. You should be able to figure this out by now.
Were you able to find your slides okay to show
The
them?
slides
So
weren't
yeah.
the issue. It's my computer. It just needed to upgrade Zoom. There was an update last night, I guess.
Mhm. So
So it's okay.
Oh yeah,
will you
everything is
try
perfect.
to run PPT one page on your screen?
Yeah, I'm clicking share right now.
Okay.
Hi,
There we go.
Jackie.
Do you,
Yes. I see screens here. Maybe a little bigger. Is that
is
you
that
just
big
put
enough?
on? Oh yeah, that one. That's the best way.
Yeah, that's good now.
And I hope you guys could hear me all right. Is this loud enough?
Oh, oh, it's a wonderful
I can
and
hear
clear.
okay.
Perfect. If any of time I'm speaking too quickly or too lowly, please interrupt me. There's going to be a lot of information, and I don't want you guys to miss it. And uh,
Mm.
I know there's going to be a lot of information I'm going to go over today's presentation. So I do have a QA session at the end with some questions that if you want to ask.
Mhm. Sure, that sounds great. And also, typically when we begin our time, I just welcome people and a little bit housekeeping parts, and then short prayer, and then turn to Terry Morrison for your introduction, and then on your stage. How does it sound to you?
Perfect.
Pastor Jean, you want to go
Yes.
back to the other screen where we can see everybody?
Right. Alex, if you don't mind, can we go back to
Yeah, I'm
I
gonna
mean
stop
stop
sharing.
sharing? Oh, yeah. So people are still on the way. Maybe two
Yeah, we're
minutes.
still early.
It's so nice to see a face, Terry. I know we've talked in a couple times.
Oh, it's good to see everybody. How is the new year being for all?
Honestly, I forgot that we enter a new year.
Did anybody make any New Year's resolutions?
To make it to another year.
You know,
No res
oh, go ahead.
no resolutions?
Well, just make it through another year.
Well, well, mine is that I want to continue to be faithful to my wife. Whatever she asks me to do, and I will do. Last night, I dug into garbage bag because she thought she accidentally threw off her something like her what are the teeth? What do you call
Mouth
it one?
guard.
Insulin?
Inner.
Mouth guard thing? Yeah, she accidentally wrapped with a paper towel and threw into a garbage bag. She was so embarrassed, and then she asked me to help. And I dug into all the garbage, three garbage bags, and found it. Isn't it good husband?
A kitty.
That's a very good husband. My father wouldn't do that.
Yeah.
Miriam, I ordered your book this week and it came, and I haven't had a chance to read it yet. But maybe you want to tell our folks while we're waiting for people to sign in about your book, if you don't mind.
Well, I have a copy right here. Oops, let's see. That way. Anyway, yeah, I'm so relieved that it's done and that it's out. And I just hope it will help some people in thinking about better accepting this older, later years of our life that can be a challenge and coming closer to God in the process.
Hmm.
So, and being accepting of
Being way
the
closer
end
to
as part of the plan.
from here.
So,
Maybe tell them the name of your book and your full name. So if people want to go on Amazon and
She's talking
check
about
it
the
out,
book of
they could.
okay,
older
it's
people.
God is with us in our later years and takes us home. And if you just have Miriam Kishi, I put my maiden name in, but just
Just right
Miriam
on our,
Kishi.
Yeah.
our counter there.
Yeah.
Didn't do it.
Yes.
I can tell with those like there. Sorry.
Oh, if you want to speak and unmute yourself and speak, please. I just accidentally mute all. I'm sorry about that.
He muted everybody.
Was I muted before?
No, I accidentally
Oh,
hit the mute all button. So
oh,
please unmute yourself and talk.
Congratulations, Marion. And I think it's great that you accomplished that huge task. And the illustrations look beautiful from just, peeking through the book. So I'm sure it'll be a bestseller in no time at all.
well, it's what being a change maker can get you doing, get you to do.
Yeah, that's great. That's great. Really proud of you.
Thank you.
Yeah, way good, way good.
Will be Alex, the presenter.
Too.
So anybody have any New Year's resolutions they want to offer? Nope, I guess we didn't make any, or we don't want to share. All the above.
Both.
I'll just say I don't have New Year's resolutions, but I have a long to-do list.
Yeah. All is good. All is good. Okay, as soon as Pastor Jean comes back, we can begin because it's
Okay, I'm here.
okay.
So, shall we begin?
Yes.
Good morning, everyone. Welcome to gen2gen 2026 January meeting. So it's so good to see familiar faces here.
Can you turn the
And
volume up?
welcome those of you joining us on Zoom today. Also, welcome
That's
to
one thing.
Alex, our speaker this morning. Well, just a quick note. If you are here on Zoom, please keep your microphone muted during the presentation and feel free to use the chat if you have any questions. So we'll make space for those later. And we are grateful that you have chosen to spend part of your morning with us, especially when we continue to our ministry of learning and caring and connection and across our generations. So let us begin with a word of prayer together. Loving God, we thank you for the gift of community, for shared wisdom, caring hearts, and the support we offer one another through every season of life. So as we gather today, open our minds to learn, our hearts to listen, and our spirits to receive what is helpful and life-giving to us. So bless this time together and all who are joining us near and far. We pray this moment into your gentle care. Amen.
Amen.
Hey, I want to turn to Terry Morrison, introduction of our speaker this morning.
Well, welcome everybody. It's really good to see you. If everybody, as Pastor Jean mentioned, could stay muted. And then obviously if you have a question, unmute and feel free to just jump right in. It's my honor and privilege to introduce our guest speaker today, and her name is Alexandria Real, and she goes by the nickname of Alex. Alex grew up in San Jose in a big Italian and Mexican family where caregiving was always considered a shared family responsibility. She attended Portland State University and got a degree in marketing and then went into that field. And then all of a sudden, COVID came along, and unfortunately, she got laid off. But it gave her a wonderful opportunity to explore other career pathways. And she learned about Home Instead, which is a home care agency, and began working there in the business development area and marketing, and has been there for 6 years. And it initially started out as a business kind of opportunity for her, but quickly became very personal and a very educational experience for both Alex and her family. In her family, as in many cultures, relying on an outside agency to take care of a loved one was just very frowned upon. You just wouldn't leave your loved one with some kind of stranger. Traditionally, when the elders became unwell, everybody pitched in. But in today's, especially today's society, especially in the Bay Area, work demands, financial constraints, relocation, and so forth, it's just not realistic for family members to all jump in and try to, provide the needed services that a lot of elderly people have. So, through her work at home instead, she's learned high quality home care can also honor the family values. Many of the agencies provide ongoing training, they do background checks on their employees. Their employees are bonded and so forth. And she'll go into more detail about a lot of that. So, with her large extended family, Alex has helped coordinate care both inside and outside the Bay Area. And so she uses her agency as well as other agencies. So she's learned what to look for, what kind of questions to ask, how to advocate for quality care and companionship and compassion and so forth. So today she will share her knowledge with us. So we will learn what to look for home care, and or if that's not an option, perhaps exploring other kind of facilities. So without further ado, we welcome you and we thank you so much for spending time with us today.
Thank you so much for that introduction. It's really great to be here and just have an opportunity to speak to all of you. This presentation, if you could see, is everything looking all right? Um,
Yeah.
this will just basically go over all your options, not just home care, home instead, but we're going to go through the continued care process and what other options there are you should look at and what's the right fit for you. Not all of these are going to be calling to you. You may go the rest of your life without even needing care at all. God bless. I had a grandparent that was like that. Uh, but I mean, this is just an option so you could be more informed and your loved ones could be more informed when the time comes. Um, so it's just, this offers you the opportunity to be less stressed for when those times do happen, when you do get into accidents, when there are care needs that you can no longer, you or yourself, or you or a loved one can no longer manage on your own. And knowing these options are going to make a whole lot of difference and it's going to alleviate that burden. So to start off, a lot of people look into independent living. Now, this is basically where a senior facility that you would move into, and the focus is community. You get your own private apartments, condos, cottages. You could expect, having your own private kitchen, bathroom, maybe even a little living room. Um, but you're not going to get a caregiver on scene there. What's really important is to understand that they will cover, you'll have meals served to you at the local kitchen. There will be laundry services, housekeeping. But when it comes to personal care, whether that is bathing, toileting, maybe just helping you get up out of bed in the morning, uh, that's going to be something that you would need to find a family member or an outside caregiver for. They do tend to provide transportation in shuttles, or you could, like, I've even seen some independent living have a rental car on property. It does vary with each community, but those are something that you should like take into consideration. Most people find these beneficial for the community space. A lot of people are reluctant to leave their homes, but once they move into these communities, they do find a new community. They find, like-minded people. There are clubs where they can join, and actually can be quite a rewarding experience for those who are looking to downsize, but also are not ready to lose any independence. Um, a lot of people think that this would be covered by some sort of insurance. It's typically not. It's you'll have to pay out of pocket. Oh, sorry, my bad. Ooh, no, I want to go back. Why is it? No, sorry. So a lot of people think Medicare, Medi-Cal will pay for this. This is typically private pay. Um, if you do need care, that's when and you still it's not like a heavy amount of care. It's, you just need somebody to come in every once in a while. Um Facilities like this will allow you to bring outside help like an agency, a private caregiver, or just a family member to help every once in a while. But, it's up to you to manage that personal care style. Okay. Now, assisted living is the next step up. So they do have caregivers on the floor that could assist you with that personal care, toileting, bathing, fall prevention. But the thing is, there is going to be less of a like they're going to be more spread out because they're going to be focusing on the entire floor, so you will have the option to that, but it will not be as focused as if having your own caregiver. um, there are nurses on site that could help you manage medication. They could help you document certain medical conditions that, such as if you have dementia or you have arthritis that needs to be tracked. They will document on site for you, but they are not going to be helping with complex medical wounds, a medical care or like wound care or intensive nursing. Uh,
Alex, excuse me. We're not seeing any of your slides. Are you showing them?
oh yeah, it's some screen sharing.
At least I'm not.
Okay, let me
I'm seeing them.
I'm seeing
They're
them.
there.
So
I'm seeing
Carrie,
them,
I'm seeing him.
but you could be louder.
oh, okay, no I'm, as she said before, I'm Mexican Italian. I have no problem being louder.
so
But
Carrie,
so again, assisted living is just the next step up. You still get that community space where there are clubs. You could still meet other people in the if you lost contact with friends or people moved out of the area, it's a really great opportunity to meet new people, to do activities, to remain active, but you do get that benefit of assistance. It's lighter assistance than, again, a personal caregiver, but it's still there. It is similarly like the living, the independent living. It will be private pay. Very rarely have I seen Medicare cover housing, but there are some long-term care insurance programs that will help cover the cost. I'll go over what long-term care insurance is. It is different from your typical medical insurance, but I'll go over that later. Um, Let me just continue on. And the next stage, which is not for everybody, most people will not end up here, is memory care. Now, memory care is for those who have been diagnosed with a certain condition, such as dementia, Alzheimer's, or Parkinson's, where they cannot safely live on their own. They need that monitoring. And this is an option. They're in close communities where they limit the wandering. If you walk in, family members will need to be unlocked. Doors are always locked, uh, and they will only be unlocked by personnel. And this is just for safety purposes. With sundowning, we see seniors wander, and that is very dangerous. So, they will also have doctors on site occasionally to help with increased medical needs comparative to an assisted living facility. Now, now I'm just saying this. It does sound a little, a little bit like a prison. It's not. I mean, it is still a community where you could still remain active. You could still have a beautiful courtyard. They do activities still, but they are more attentive to your medical needs. Um, there is more specialized caregiver training, especially with dementia specific communication skills. Um, there is ongoing disease prevention. A lot of families did struggle during COVID with these communities because they had to lock down essentially with COVID. It did spread very fast because they're very enclosed. And so when outbreaks do happen, there might be a little bit of an issue visiting because for the safety of the staff, for the safety of the residents, that is the priority. Now, this is a little different than the previous ones because there are options for more coverage in long-term care insurance. VA benefits will also cover memory care, and there are some Medicaid programs or Medicare, uh, sorry, not Medicare, Medicaid programs that will cover some memory cares, not all. Every memory care is different. This is something that when you go to them, you want to inquire what are their coverages. Um, it is typically, if you are paying out of pocket, it is more money because of the specialized care and security that they are providing. Um, Now you will see in the Bay Area facilities called continued care facilities. Now they will have they'll have all three of these options available to you. They'll have an independent living where you can graduate to assisted living. And then if need be, there is, you graduate to memory care. Now, some people will remain in one of these housing for the rest of their lives. They don't really need to move on necessarily. Uh, that being said, just because you may go to a community that has an excellent independent living or they have an excellent assisted living, it doesn't mean that every single branch of that facility is going to be the same fit your needs. I do advise families to investigate as much as possible. Just because you move into this community, maybe the assisted living is not to par what you need. Maybe you need to move to a different assisted living. These people sometimes they think that it's all going to be very much the same. I'm not going to sugarcoat any of this when it comes to the living facilities or the home care. You do need to do a great amount of research when you're doing this. That being said, there are easier ways to do the research. You can hire someone called a geriatric placement manager. Now, these people will come in and you'll give them your budget, you'll give them what you're looking for in terms of your care needs and what locations you're looking at. And they will present to you an option. They're kind of like real estate agents, but for senior living facilities. And they are pretty good with not only helping you sell your home, downsize your things, and then also move in. They will help you throughout that entire process. And I will be emailing Terry some contacts I have in the industry. I've gone through a lot so far, so any questions so far? Terry, can you still see the slides or are you still having issues? Terry?
Terry, are you seeing slides here?
Yes, I am.
Okay, great.
Okay, well then I'm just gonna move on. So, so I've been working with Home Instead for 6 years now, and we do get a lot of calls, and there is a little bit of confusion. Sometimes we get calls for home health care. That is different from home care. I know they're very similar, and don't feel bad. I actually work with a lot of nurses and doctors in the industry who still don't know the difference, who have been in it longer than I have. And so, home health care is typically medical care. So you will have nurse, therapist, even doctors will come in and they will do that in-home medical care, whether that is wound care, injections, vitals, education on physical exercise, whether that be occupational speech, um, you'll typically be assigned a social worker that will oversee your care during this time. And it is typically for seniors or patients recovering with ongoing conditions. It's for those who are homebound. And the thing is, they are, even though they do a lot of care needs that are medical in the home, they are not caregivers. They are not going to provide bathing, meal preparation, a light housekeeping, anything non-medical, they're not going to touch. They're there for maybe 1 to 2 hours, depending on the agency. And they can be quite expensive. They are covered by your medical insurance. So if you're insured, you would inquire through your doctor, and you can like call individual, like you can call, like look up online and look for home health care yourself and see if you're covered. I would suggest just going through your primary doctor and asking for a referral because they will know who is covered through your insurance. It's just easier by that. Um, that being said, if you are curious about home health care agencies, I could also provide that via email. Now, home care is what I primarily do, and it is, again, non-medical caregiving. So you're going to get the bathing, the dressing, the grooming, hygiene. Um, it is typically for seniors that want to remain at home or need a little help in their private residence. Um, if you need help with daily tasks, whether they are personal or just, you need somebody to drive you to the grocery store, the doctors, if you have memory issues and you're just forgetting things here and there, we are here to fill that gap. Um, a lot of people, they may go out of town and mom may be independent. She may be fine, but, she had a fall 6 months ago. Let's temporarily hire a caregiver to make sure if she does fall, there's someone there to check up on her. There's someone there to make sure that mom, who might be forgetting some things, is eating her food. Documenting all of this. A lot of people tend to like us for the documentation because if your mom or dad is suffering from dementia and you're just visiting them every other week, you may not see the changes. But if somebody's there, they could document that. As a caregiver, we could slowly document, okay, we're noticing you're forgetting X, Y, and Z more frequently. We're not remembering people's names. And this is important because then you could show it to your doctor, well, your loved one's doctor. And that will be important to making diagnosis for their condition and also getting ahead of what to do. Now, typically when you go to a home care agency, you'll be assigned a case manager. Now, they will create a care plan curated to your needs, and that is subject to change, whether you are declining or even healing. Some people use us for the rest of their lives, some people use us temporarily. Um, it is something that does vary. And it's not necessarily just for seniors. We've had people as young as 29 use our services for recovering from post-surgery. And during that time, that case manager who curated your care plan will also oversee your caregivers, whether that's one or two or five, depending on the level of care that you have. They will oversee and work with them, make sure that everybody's on the same page, and make sure your care needs are being met. Now, this does vary agency to agency. So sometimes home care can only be covered by private pay. Sometimes sometimes home care agencies will take long-term care insurance or VA aid and attendance. Now that does vary again from agency to agency. The VA benefits in general, you're going to get two different options as a veteran or a veteran spouse, whether they are deceased or not. You will get the option of X amount of dollars to be paid, that the VA will pay for up to 12 hours for a home care agency. Then there is the other option where they will give you a couple $1,000s per a certain time period, whether I think it's a month or 2 months. That is the aid and attendance program, and that is for if you want somebody who is not licensed, bonded, not with a home care agency. They could be your daughter, they could be your grandson, they can be your neighbor, and you could pay them to take care of you. So that is two different VA benefits that you could look into. Um, Again, not all home care agencies have that. And not all home care agencies are the same. Now, there are two types that you'll probably run into. One is Home Instead, where all of our employees are licensed and bonded. Now, what that means is that our caregivers are employees. We have liability insurance. If Susie walks down the hallway while she's taking care of your dad and she breaks her arm, she gets workers' comp through us. You know, while she's working on the job, your that space is her work environment. So we will be be overseeing her recovery and coverage. Also, we do a litany of background checks with all of our caregivers. We fingerprint them. They have to be registered with the Department of Social Services. If at any time they have anything on their records from the time they were 18 and up, we do not hire them. We're fairly strict. Now, the other home care agency that you'll run into are contractors, and there is nothing wrong with these. I've actually hired some of them for my family outside the Bay Area, and they've worked out fine. Now, these are, independent caregivers. They do great quality job. And in fact, some of the Home Instead's best employees worked independently through these contracting agencies for years. And I would trust them with my own parents. So, the only caveat is there aren't any background checks. You do have to pay, you have to go through quite a bit of tax forms on your own. 1040 is not going to cover it. Home Instead does cover that. When you go through a licensed agency, that's something we take care of for you. Um, and it is long-term care insurance typically will not pay them. If you have that and you want to pay your caregiver, they need to be through an agency. And I'm just going to pause really quick because I've, again, dumped a lot of information on you. Do we have any questions so far? Anybody talking?
You might want to check the chat, Alex, that there's a couple things in the chat.
Okay, what? I can't see the chat all of a sudden.
Oh, you can't. Okay.
Let me, where is the chat? Okay, I just saw it because I answered somebody's question earlier.
Okay.
Click on
Good.
the chat icon at the bottom of the screen.
Oh, there we go. Okay. I can see. Alex, are your caregivers CPR certified? Now, that is an excellent question. Even if they are, we cannot provide CPR on shift because that is a
Right.
medical need. If for some reason your loved one is having an issue, what we do is we call 911.
Yeah.
We typically ask that the family members have an emergency list. We know the hospital and the emergency services will come and take care of that. If there is a fall, whether the person has injured themselves or just can't get up, we call non-medical emergency services to come and they will just assess. You don't have to go into the hospital. We just do it because we are not we cannot medically clear to say you're all right. You just slipped off the couch. California is very strict with that. We cannot manage your medication. Now, we can provide medication reminders. If you have a Medipack, which is the AM, PM, Monday through Sunday thing, and we take it out, give you a glass of water, that's fine. If you're asking us to open a pill bottle that says once a day with lunch, we cannot do that. Our hands are tied. State of California is very strict with healthcare rules. However, agencies like Home Instead will typically partner with private nursing agencies such as the nursing registry. So if you do want a referral, we can give that where somebody could come in and do medical needs again in home, but that is something that's out of our scope of care. We can take you to the doctor's office. We can we could drive you to any medical offices within the area. That is within our care. And then also we can report if we see something off. We'll talk to, you, the case manager, and if there is a power of attorney involved. Now, power of attorney is something that I encourage everybody to get in order. It's better to do it while you're state of mind, because what we will see in the industry is, Tom is feeling great, and then one day he starts forgetting things, and then suddenly he has mid-stage dementia and he's been diagnosed. Well, his daughter can't manage his care. He can't remember who to call. He can't take care of any of his bills, and it is very hard to get a conservatorship. So it's better now to get that ready in case, so your loved ones are taken care of ahead of time. All right. Oh, Sue, you have a question?
Just a thought in regards to when you have a new caregiver come to your home for whatever reason, do you guys like I'm thinking if it would happen to me, I would want organized where they could see it. If I had to call the paramedics, what your meds are, who your local contacts, emergency contacts are, all that type of stuff. So at least they can give information to the paramedics when they come.
So yes, we do that.
Okay.
So when the case manager meets with you and they come up that curated care plan, they will
Yeah.
come up with a list of emergency contacts, and then they will also ask who your primary care doctor is.
Yeah.
And we ask that information. It will also be in their binder where they will document your care
Perfect.
throughout the shift. But we also ask another one to be on the refrigerator,
Mm-hmm.
in case that does happen. Um, they also are caregivers. Now, I can't speak for all home care agencies. We're all different, but for home and said caregivers, we do have an app where they do clock in and they will have that information available on their phones. A
Oh,
lot of
good.
people are concerned about the phones. I've heard this from my loved ones. I've heard this from my clients. I don't want to pay somebody here to be on their phones just texting the entire time. That is an issue. Um, I can't say I haven't heard that complaint about our own caregivers. However, I will say we have always addressed it and it's always been resolved. Um, Sometimes it's just the caregiver documenting their shifts. They prefer to document on their phones. That being said, not all of our caregivers are going to be great fits for you. And that's perfectly all right. And whether it's with Home Instead or another agency, you should be able to request as many caregivers as you like. If it's not working out, home care is here to, again, alleviate your stress, not add to it. So that's something you should take into consideration when looking at these agencies. If they're very tight at the time, but that's one thing. But if they're constantly not providing ongoing care, that meets your needs, it might be time to cut your strings loose and find someone else. So, come back.
Thank you.
Oh, no, no problem.
Yeah,
Now,
Alex.
so questions family should ask. This has been out for a little second now, but goodness gracious. So again, I've gone over, are your caregivers background check? What kind of training do they do? Now, this training can vary. Some people will just, hire somebody, put them in, ask what their background is and just put them in the house. Home Instead currently does, we do onboarding for 2 days. We do online training, and then we do shadow shifts. Now that's something, you should ask like each stage when you are inquiring whether it is an agency or not. How long have you been in the industry? Now, I could say for a fact there are some people who've been in the industry for 20 years, and I'm gonna be honest, not the best. But there's some people who we have a lot of young people, a lot of new young caregivers fresh out of high school who are excellent. They've never done any home care for a loved one, and they just jump right into it. Sometimes you just have to find the right personality fit. Now, another issue you'll find in the industry, which a lot of people have a concern with, will I have a consistent caregiver? Now, that is pretty important, but I do want to give a little leeway to my fellow agencies that if you have long shifts, now we're talking, you have 8-hour shifts, 7 days a week, you're probably not going to get the same caregiver because a lot of agencies, they tend to have caregivers in different areas. So you might get 2 to 3 caregivers. What's important is, are you going to get those same 3 people every time? You want to ask those questions. What's the consistency? Am I going to get I don't want a different person every day of the week. If that is the case, flu season hits. It happens. We can't have caregivers with a cough going to a senior's home. Well, how long is that going to last? Or is this an ongoing problem? I already stated Home Instead has case managers. You want to make sure there is a point of contact for you, whether that be a case care manager or a lead caregiver. That's really important for you to, like, you don't want to be discussing, unless it's a private caregiver, directly with your caregiver, because that caregiver more likely is not going to tell the next caregiver on shift. So that's something that's pretty important. And yeah, so the next thing is scheduling and costs. So you want to ask, what are the minimum hours? Home Instead currently has a minimum of 4 hours a day, 12 hours a week. That does seem a lot for some people. Some people like to have less than that. It is very hard for agencies to find caregivers that can come into the home and do less than that because, again, they have to move to different clients and such. What Home Instead does typically do is, if you are being discharged and if you just want temporary care below those minimums, we can work with you by case basis. Um, that's something that you should inquire about. Now, how fast can care start? For some agencies, depending on how staffed they are, they could start the same day. What you want to be prepared for is you want somebody to come in and do a care consultation with you. They're going to create that care plan for you. They're going to have you sign contracts, and then they are going to introduce a caregiver. Probably just come back with that introduction. That's something that's fairly typical in the industry. That being said, some agencies need 48 hours. They maybe need a week. It does vary agency to agency. Now, Home Instead, I hate to brag, we are pretty good at staffing same day. However, that does change with, when flu season hits and such. It really is just something you want to ask when you're on the phone. You cannot go into, when you're talking to somebody and just expect that they're all going to be available. It does vary with seasons. As you know, you guys live in the Bay Area. It's a little expensive here. Care is probably the most expensive in all of the country. You'll probably see rates from $38 to probably $55 per hour, depending on your level of care. That's something that is fairly staggering for some families. The rates are typically covered by long-term care insurance, VA benefits, and there are some Medicaid programs that do cover it. Now, that they don't do that with Home Instead, but that is something you can inquire about with different agencies. Another thing that comes up is, what happens if my caregiver doesn't show up? A reputable agency should have someone on standby. They should be calling you, letting you know, like, hey, Susie's running 10 minutes late. I'm sorry, Susie's sick this morning. We're going to send Carrie in to fill in for her. Or we will, or they will ask you, do you want to cancel this shift? Do you really need somebody today? We will reimburse you. Those should be your options. If somebody is not showing up for the shift, there is no communication, you probably want to cut your losses. Now let me just go to the chat because I think we have new questions.
Well, John and Jenny raised a question that do all caregivers can speak English?
So at home instead, and most bonded agencies, it is an expectation that all the caregivers speak fluent English. Now, we do have caregivers that have accents, and I understand that, it's not from a place of bigotry. It's just, you might have hearing aids. So that might not be ideal for somebody who can't hear well. And, that's something you can inquire. But you should expect that all caregivers speak English. Now, private caregivers, that's a different arena. But at bonded agencies, that is the standard. Sorry, speaking of coughs, I'm starting to get a little itchy in my throat. Um, Alrighty then. So I'm gonna go to Q&A. Okay, I'm seeing something about Genworth.
That's their cost of care site. It shows the cost of care for the various types of care on the country, state, and local. They revise it every year, so it tells you pretty much what the care is going to cost in your particular area.
Yes. And as I said before, Bay Area is one of the more, especially the Southern Peninsula, is one of the more expensive ones. Typically you'll find, lower rates, maybe again around the mid 30 range with private caregivers, and that's what people typically go with them because there isn't that training, there isn't the bonded license, and there isn't the background checks. But again, that could be a better fit. There um, typically is no wrong answer when it comes to caregiving. It's just, it's like finding the right pair of shoes. Now, do we have any questions about VA benefits or continued care facilities? I know I went over a lot this last 40 minutes.
I have a question not about that, but you mentioned having a sheet on your refrigerator that gives out emergency information. And so I was working on that, and I listed my son, I listed neighbors, I listed my primary care doctor. Is there anything else? Oh, you suggested medications, I think. Is there anything
So
else that you would?
medications should be if you're going to have a caregiver on site and give you reminders for them. That typically would be in a meta pack. You could get them at Walmart, CVS. Your doctor could provide them. Those are the AM PM Monday through Friday. We don't need those on the fridge. What another thing you would probably want on the fridge besides the emergency contacts is your advance directive. So let's say Michael falls and is unconscious, is not breathing. Emergency services come.
Okay,
Do you want to be resuscitated? Do
right.
you
So the actual document.
a copy of the document?
Oh, okay. Yeah.
Actually, the old vial of life has been replaced with the life form now. I put that in the comments. It's now a rubber folder with a magnet that sticks on the door. It has its own form for all these things that we're talking about that you put in for first responders, and it's on the door rather than in the refrigerator now. And I might also mention there's a great device for people that are solo agers. If you uh, live alone and your house is locked and a medical emergency happens, you can get to 911. Well, they'd have to break the door down to get in, but there's a lockbox called the Knox, like in Fort Knox, that goes on the outside, has your home key. First responders will use that to open the door to be able to get in and save you the cost of breaking the door down.
Oh, I need that. I fall down the
Great,
stairs twice a week.
great. That's good information. That's great to know.
I'm seeing a question from Leslie about live-in caregivers. Now, a lot of agencies do not do live-in care. Some do, but it's very hard with the state of California to be up to code with that. Due to the fact that, it's hard to manage uh, you know, the hourly pay. Um, Home Instead does not do that. You typically will find a reliable live-in caregiver through a private caregiver. Though it's not out of the question to ask agencies that. But I will be honest with you, they're not very common. Now, that being said, each home instead is independently owned and operated. Um, I have heard in the past that home instead San Mateo, if you live in that area, probably don't because you guys are all here. Um, might do that. Each home instead again is individually owned and operated. My branch covers from Cupertino to Belmont, and you
Oh,
may
wow.
call and inquire for care outside the area. You want to call that home instead who, if you live in that area and just inquire because what we sometimes offer is different. They all vary. So, and that does, other agencies as well.
And I'd like to point out that I am in the aging business at several different levels and have been for decades. And Home Instead is one of the best, if not the best, home care agency that I've found. So you probably want to start there.
Oh, well, thank you. No, I don't want to be I'm trying to keep this as fair because there are some very reputable home cares in the industry. I'm a little biased because I have worked at home instead and I've seen what we could do. Um, However, sometimes we're not a good fit at the time for some of our clients. I'll be honest, there's some people who've left dissatisfied. That being said, we've been the best thing to happen to some of our clients. Um, if you do want to, use Homans as a resource, I will say we are very integrated with the community and we do work with our other home care agencies, even our competitors. We also work with other geriatric services, whether that's home health safety, which they'll come in and they will put in rails. They could put in shower bars. We work with nursing agencies, home health, hospice. We work with a lot in the community, so you can just use us as a resource to reach out, just inquire about certain services. We're not just here as home care. We're here as support for our community.
And don't
At least
forget,
that's my job. I'm sorry.
you can find Home Instead if you just Google it for what particular area that you're looking for. Remember, Google and ChatGPT are your friends.
And Homestead's website will match you with the closest agents, the closest franchise to your zip code. So you would go in and you fill out your care needs, and then we'll ask for your zip code, and we'll match you to that home instead. In fact, I could show you right. I'm sorry. My goodness. I had dinner with my mom last night. I'm regretting it. Can we see the website?
Nope,
Let me see.
you got to share screen and go to um,
There we
the
go.
site. Yeah.
So, this is the homeinstead.com. So let's just say you are looking you know, for yourself. You would go in, click what you need, and then you would go to your postal code. So let's just say 95123. So this is where my parents live. They would be matched with our Campbell office. So this is the territories they cover. and then you would fill out an online inquiry. Now, they will call you back. Some people typically don't really care for that. Sometimes they want to go to the nearest office and call directly. That's something that's also an option here. So we would again put in that postal code, click that, and it's going to bring you to that, excuse me, sir, that page, and you will have the phone number to that office. So that's just something that to keep in mind. Now let me go back to the comments.
You might want to define sundowning. You mentioned that in the memory care section.
You're muted.
Oh, sorry. What was the question about sundowning?
Could you define it?
So sundowning is typically it is a state of confusion that we see with mid-stage or late-stage dementia, whether that's Alzheimer's or some sort form of dementia that causes a state of disorientation and confusion. We see call it sundowning because it typically happens around that time of day. However, it could happen, it's kind of a misnomer of a name because, uh, like morning sickness, it could happen any time of day, but it does happen. If it does happen one type of day, it will continually happen repeatedly around that same time, and it is what we see typically with that is the long pacing. There is a confused up and down pacing where they're in a state of confusion and agitation. Now we'll see sundowning quarters in memory care facilities built for seniors like that. you know, um, okay, I'm sorry. I'm seeing a new question in the chat about Homestead in the state of Washington. So Homestead is actually international. So we're found all throughout America. We're found in some parts of Canada, Germany, and I'm pretty sure we might be opening in Japan soon. I mean, I know they need it. Um, you know, uh, we do have homesteads in Washington, though. So you will find it there. Um, I can't think of a place in the United States where there isn't a home instead that doesn't provide service. So I'm seeing Jackie wants to know about transportation options. Excellent question. So for home care, there are typically you'll at home care agencies you'll find that the caregiver can drive you around or drive your car. Specifically at home instead, what we do is if you want us to use your car, if you have a car, you have car insurance, but you're no longer allowed to drive. Your son doesn't feel comfortable with you driving anymore. My mom doesn't feel comfortable. And, it happens to the best of us. She doesn't like when I drive. She says I'm the worst driver she knows. Um, we could use the caregiver could go in and use your car at no additional cost and drive you to where you need to be. Now, if you do not have a car and you would like the caregiver to use their own car, the IRS asks that you pay them at least 70 cents per mile, uh, during that time of usage. Um, where the average hours a client per day. What can clients afford? Now that does vary client to client. So typically a lot of clients have shifts from 4 to 8 hours. That could be 3 times a week. It could be 7 days a week. It does vary depending on what they have, what are their funds. Um, some clients with their long-term care insurance, which I'll go over in a second, can afford care around $300 a day. That would cover around like a 5-hour shift. Depending again on the level of service, the service does change. So Home Instead's current rates are around uh 43 to $50. That is, I believe that will be changing with the new year. So I will email Terry our official rates that just double check because I don't want to give any misinformation. We do this every year to keep up, making sure we can pay our caregivers a livable wage. Um, but that's typically around the rate. Um, that does vary with your level of care. So if your sorry, it's 43 to 50. Yeah. So if your care needs are very minimal, you just need you there's no personal care, you just need somebody to help you around the house, you're a fall risk, you might need help with laundry, you may need somebody to drive you to the grocery store. That would be on the lighter end. If you are needing transfer assistance, you can't get out of bed, um, you can't bathe on your own. That's something that will bring you up to a higher rate. If your loved one is suffering Alzheimer's and it's causing them to be a little bit more aggressive and difficult, that's something that could possibly bring up your rate. And that is typically decided at the care consultation where the case manager will create a personalized care plan for you and they will do their own assessment of the situation. Now, I talked about long-term care insurance. I'm sure you guys have questions on that. That is something you've had to pay into for years. It covers your medical care, whether that's in nursing facilities, memory care, home care, home health. It will basically that is a separate type of insurance. If you have a medical insurance and you think that it's covered, it's not. It's kind of like having house insurance and then having fire insurance. You would think one covers the other, but it doesn't. Um, and like fire insurance, once you're in the season, it's hard to get it.
Um,
Um, so I'm
I
looking
do
through.
sell long-term care insurance, so if anybody has any questions specifically about long-term care insurance, you can contact me. I'll put my contact info in the chat.
Now, is this Skip speaking?
Yeah,
Okay, Skip, we gotta get connected after this.
yeah.
Um, I'm looking for a short trip sorry, no, go away. Short transportation options, not a bus or taxi. Okay, that is something that's out of scope of care for a home care agency. However, I have heard of there are some things that are similar to Uber or Lyft, except for it allows a third family member to keep track of where you're going. They could call and set it up for you. It's very tech savvy. I've heard on the streets about it. Now, have I used it or had any of my clients use it? No, but that's something I could look into for you. But that is not something that Home Instead would do. You would also need, we could drive you to places, but that wouldn't be our only function. I don't have a smartphone and text. Yeah, I think that that is a little difficult.
There is an agency, I think it's called Grandparents Something, and you pay a monthly fee, I understand, and you actually call them on the phone. And so no smartphone is involved in that. I could find out the exact name and contact information.
Go grandparent.
It's
Yeah,
called no, it's
that's it.
called Grand Care Systems, and that's part of it too.
Say that again, please.
All right, the site is Go Grandparent, and the website is that no spaces, so GOGO grandparent.com.
Just put it in the chat.
Good idea.
Hey,
Um,
so
there's another thing that you want to inquire about is sometimes home care can provide pet care. If you're recovering from a surgery and you're hiring us, maybe you need somebody to walk the dog or clean the litter box. Those are some like everyday tasks that you may need assistance with, and you should inquire to that agency if they do have that. Home Instead does. We love dogs and cats. Snakes and spiders, not so much. I haven't met anybody who's requested that, but that's always a possibility in the back of my head. I'm like, oh, we're saying pet care, and pet can mean so many different things.
So any other questions? Well, Alex, thank you so much for your, precious time and presentation and your resources that you shared with us this morning. We're very
Great,
grateful to you.
great information. Nicely done, Alex. It's very nice. Good information.
Alex, thank you so much. And before you all sign off, just real quickly, February 20th is our next program. And Dr. Pompey will be talking about Medicare updates and advanced directive, new information, etc., for 2026. So please mark your calendars. I'll send out a communication. And then March.
Put down and see if our name is on there.
February 20th is that date. And then March 20th, we're going to have a speaker on AI and chat GPT to refresh our memories from a couple years ago when we had it, and also to educate us if we choose to be educated on AI and all that. So again, February 20th is our next program, and then March 20th is the one following. And of course, I'll send communications out to everybody. But Alex, you gave us so much good information, and we'll compile it, and then we can email it out to all of you along with her slides if that's something you all want, just to have information at your fingertips. So
and please reach out. I am a resource. Even if you want other recommendations for other home care agencies, I'm willing to give it. Or just have general questions. It's my job to inform people in the community, whether it's about Home Instead or other services. I can connect you. And if you have any follow-up questions, please reach out. Terry has my email.
Thank you again, Alex. And also, Les, we record our video presentation today, so we will share with you later. And also, friends, thanks so much for joining us today on Zoom. And may you go in peace and carrying the insights and resources that you shared and received
27 people.
today. Okay, take a good care. We look forward to seeing you again soon. Blessing to you all.
thank you, Alex. Thank you,
Thanks.
everybody.
Alex.
Thank you for
Bye.
having me.
Have a good weekend. Thank
You
you.
too.
Bye.
Bye.
Around 30 people joined us, so great. Thanks so much,
It,
everyone.
it's very much a need. It was very timely, good information
There we
that it's
go. Yeah.
need in the area. That's for sure.
All the
Thanks so much,
people.
Sue, for your input as well.
Welcome.
We'll continue to learn together and connect together again. Bye now.